The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
What other hormonally mediated changes do we see to the skin once menopause begins?
Yeah, so collagen's a huge one, but honestly, other things include dryness and itching of the skin, what we love to call pruritus, which is the medical term. So you may have to avoid soap or washing as often, and you may need more moisturizer. You may, unfortunately, get an increase in adult acne, which hey, you're an adult, you're well past being adult, and yet this new onset of adult acne. Just be aware of that. That can happen. You can have increased hair growth. I don't know if I can pronounce this, hirsutism. But yes, you may have increased hair growth post-menopause. And melasma, which you may or may not have after pregnancy or just in general, it becomes more obvious, more frequent. And the big thing, I think, is harder to get rid of post-menopause than pre-menopause. So just be aware of that. Melasma is a fancy dermatology term for sort of a rash on your face. It looks like a butterfly usually. And that is just harder to get rid of. And finally, of course, people love talking about hot flashes. Well, unfortunately, your facial skin may also experience flushing. That's to be expected to a certain extent. But if you have rosacea, then it actually gets a little worse after menopause.
Okay, and so none of these changes are welcome. None of them are like you enter menopause and my skin is now glowing. So we do have answers for some of them, right? So when we talk about excess hair growth, and of course it's not in places that we want. It's not like, oh, you've got more hair growth on your eyebrows, your eyelashes, or your head. We're talking hair growth on your chin. No woman wants that.
Right.
So we have laser hair removal. Now I tell patients, if you notice that you're getting hairs on your chin and you are fortunate enough that you are a brunette and not a natural pale blonde, go get those hairs lasered before they turn white or gray, because once that happens, you cannot get rid of them as easily. So that's an option. Acne, of course, we're well versed in taking care of acne, or especially our dermatology colleagues. So there's options there. Melasma is very difficult to treat, whether it's the pregnancy related or hormonal, but there's some good chemical peels and chemical masks that we do. And then facial flushing or rosacea also can be difficult to treat, but dermatology has some options for that. But unwelcome changes.
Yes. I mean, fortunately, there are ways to treat them all. But yes, it would be annoying if you're an adult, and great. I have more adult acne now, post-menopause. Wonderful. So it can happen.
And when we were talking about this topic before, you had mentioned the fact that time does not help any of this. What did you mean by that when you were mentioning it?
Yeah, I mean, the more you sort of let it go, so specifically whether you have melasma, whether you have hirsutism, as you mentioned, extra hair. Weirdly enough, I mean, if you can't nip it in the bud, that's okay. I mean, you just want to be aware of it, and then you want to treat it a little sooner as opposed to later. I mean, melasma in a 70-year-old is going to be a lot different than if you're treating it in someone who's 50 or 30 or whatever. If it's really set in, it's harder to deal with. And you mentioned hair removal, of course. I mean, you'd rather have dark hair against light skin. That's when you get the laser treatment. You don't want to be having, white or gray hair. The laser has a hard time eliminating that hair follicle.
Yeah, you need to have the pigment. It needs to target something to go after that differentiates it from the surrounding skin. So time is of the essence when it comes to that.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.